Yeah. Hi everyone, good morning po, and thanks for joining us today. Today is a beautiful Monday, Manic Monday ba? Ayan. We have another episode po of Ask Dr. Ana. I realized po that we had one last Saturday, kaya lang po, ang dami pong humabol na tanong because na-late po yung aming announcement. So to give way po at nakakaya naman ho dun sa dami po nang nagtanong, we're holding another session po today of Q&A po, questions with Dr. Ana Bondoc. That's me. Pasensya na po, I do not accept OB and pedia questions because I'm not an OB and I'm not a pedia. For those po with pedia questions, the first pediatrician ever guest natin will be here on Thursday to discuss measles. Her name is Doc Tina po. And Doc Tina po can answer a few pedia questions from you. For those po with men's health questions, Doc Dodge is coming back tomorrow. So today po, pagtyagaan nyo na lang po, we have a Q&A, Ask Dr. Ana. My name, I'm Dr. Ana York Bondoc. I am a pulmo and critical care specialist po. I'm also a psychologist by training. And I'm here po in San Juan, San Luis, Pampanga. So again, before we start po, ipagkalinaw-linaw ko lang po ha, our advice po is general. Hindi po siya individual para sa inyo. And I cannot comment po on your individual case. The best thing that I can tell you po is kung meron po talaga emergencies, and I highly recommend OKOPD. Free telemedicine po yon by the Jose B. Lingad Memorial Medical Center. I'm very proud to be Kapampangan and working with the JBL Hospital. They will answer po yung specific po na mga tanong ninyo. Yung advice mo na ibibigay natin is general to everybody. Okay? Pasensya na po, but that's the way po that's the way Q&As po on social media run. Hindi po talaga, we cannot answer everything po na specific to you. But we will do our best po to give a logical and educational answer. So sige po, Miss Reina, let's start. I think we have a lot of questions that arrived late nung Saturday. So okay, kasa na po natin question number 1. And again, I did not read the questions po beforehand para parang nasa clinic po talaga tayo na ngayon ko lang po nakikita yung question nyo. Okay? So Miss Rains, Miss Kat, would you like to read the questions? O siguro palitan lang po kayo. I have 2 assistants, Miss Kat and Miss Reina. Ayan po. So sige Miss Rains, would you read the question please for me?
Loading lang po siya, Doktor. Sandali lang po.
Sige, basahin mo na habang naglo-load.
Sandali lang po. Medyo hindi po Ayan po yung screen, no? Wala pa po yung mismong, question.
Can you see it on your laptop? Would you like to read the question na muna?
Sandali lang po, Doktora. Bati muna tayo, Doktora, habang naglo-load po siya.
O sige, bumati na lang po muna while we're having a little technical difficulties. Ganyan talaga dito po. From Maria Cecilia Loyola, hi, Dr. Ana. Hi, ma'am. How are you? Opo. Thanks. From Kapitana, how are you? Magandang umaga po. Thank you for joining us today. Normally, we do it in the afternoon, but we're happy to be here in the morning kasi po naka-sem break po si Benji. From Arlene, magandang umaga po. Pwede po kayong magtanong. Please type your questions. Ay pala, we're not only answering the questions nung Saturday. Please put your questions below. Sa if you're interested, please like and share po. We are also live streaming na po on YouTube. Okay? So Miss Arlene, thank you for joining us. Lagay niyo lang po yung tanong niyo. From Patricia, good morning, Patricia. How are you? Sandali lang po, I'm searching for the questions also para ako na lang ho ang magbabasa. From Enrique, hi Enrique, good morning. From Talia, Talia, how are you? Good morning po. Dali lang po. Ako na rin ho naghahanap. From Mr. Danilo, magandang umaga po, sir. How are you?
That's all that we have for greetings, Doktora. Naglo-load din sa akin, medyo mabagal lang.
Eto, I'll just read it na lang po, no? From Miss Larin Zari. Halimbawa po ay may sakit na po dati na pulmonya at hika. Ngayong pandemya, na ospital kailangan ng swab, then result is positive. Anong history ay di ka naman lumalabas ng bahay o mga kasama mo? Paano po kayo nagkaroon ng COVID? Ma'am Larin, ang tanong ko, kung wala pong, I love this quote of Reyna, kung wala pong lumabas, meron pong pumasok. Okay? Ang tanong ko sa inyo, talaga bang walang lumabas sa bahay nyo? Okay, fine. E paano kayo nagkaroon ng pagkain? Sometimes, people, ito lang ang naano ko na rin. Dami ko na rin, there was mga tao dito, wala daw lumalabas. After 2 days, may apo palang nagtatrabaho sa Metro Manila. Yung kanila palang kasambahay nagkasakit, umuwi. Their daughter, who was working in Zambales, came home. Sometimes talaga, ma'am, yung mga tao po, hindi po talaga nila sasabihin sa'yo in the beginning the truth. Kasi po, syempre, natatakot po sila, baka sila yung nagbigay ng COVID sa kanilang lolo or lola. But later on po, pag nakuha niyo po yung trust ng tao, meron po talagang lumabas. And please don't tell me wala pong pumasok. Paano po sila kumain for 6 months? Don't tell me they have a ref and a freezer po na naka-stock po na 6 months. Kung minsan po, pati lang po yung delivery guy ng Lazada, walang mask. O naubo po si delivery, naubuhan kayo po walang mask sa loob ng bahay. No, hindi kayo lumabas. Wala rin naman pong pumasok, pero nagkita po kayo ni delivery dun sa gate. O, paano yun? So, logically po, I mean, we only work po on logic, hindi naman po multo ang COVID eh. So, meron po talagang pumasok, promise. Kung wala pong lumabas, meron pong pumasok. And eto lang, ha? This is my honest, And I'm not accusing your lolo, your daddy, your husband, your brother, whatever. Kung minsan po, merong ginagawa yung mga tao na medyo personal sa kanila. Like, nambababae. Sasabihin ba nila yon dun sa contact tracer? Di ba nga nagsaksakan ho, hindi na lang ho COVID ang ikamamatay ng mga tao, pero sama ng loob at saksakan. Okay, guys, so, people are people. They are not perfect. They will make mistakes. Wag po natin silang sisihin. Wag po natin silang, sometimes people won't tell you kasi they're scared na you will judge them. Pero I promise you, hindi po multo talaga yung COVID, may nangyari. Para ho yung nabuntis. Okay, may nangyari. Hindi po pwedeng hindi. Sometimes from the packages, yun po, from the delivery guy, and from other people na parang may nangyari po talaga. Promise may nangyari. Ikaw, Rina, what is your opinion on this?
Nako, Doktora, yun nga, sabi ko nga, di ba, kung walang lumabas,
I know what you
merong pumasok or may nakapasok. Either, kasi there's no proven fact yet for the Lazada packages or any packages, no? But definitely, may carrier. May carrier na nakapasok. And we all know that this is already an airborne disease. So kung di naman pumasok, may dumaan, umubog. And then, ayun na, naliparan na ng hangin. Yun po.
Yeah. Hindi po talaga pwedeng, and sometimes really, Reyna, I would like to say this. Di ba may song nung unang panahon, sapagkat tayo'y tao lamang, nagkakamali po tayong lahat. And sometimes we don't want to admit it to the contact tracer kasi nakakahiya. Aminin mo ba na nambababae ka? Aminin mo ba na you went somewhere na that's not the right place to go? Siyempre, you don't want to say that to the contact tracer. Barangay captain yun eh. In 1 minute po, iikot na po yun sa barangay na eto po yung nangyari. Okay? So, yun po. I'm really telling you, there's no such thing as a ghost COVID. Okay? Second issue po talaga, sometimes people tell me, how come na-test po lahat ng kasama po namin sa bahay? And they are all negative. So where did the COVID come from? Ma'am, either somebody's lying or eto naman ang wag na yung somebody's lying kasi pangit din ho yun, ano? But sometimes by the time po that we did the swab testing po, tapos na po yung 9 days nung unang nagdala. So negative na siya. The rest of the people there, sila na ngayon yung positive. Kasi there is a time frame po for the swabbing. There will be a time po na baka siya po was asymptomatic and then very super mild si COVID. And then dumaan na po si 9 days. So on the 10th day, swinab po natin. On the day 5, yun po yung mga ibang nasa bahay nagkasakit na po. Okay? So yun po yun. I do not want to say bad things about people. I don't want po to question yung mga ginawa nila. Wala ho tayo dito para manghusga or to say bad stuff. Pero hindi ho pwedeng hindi may nangyari po. Okay? So thanks for the question. And again, kung may nangyari man, I would like to stress this. It is not our job na husgahan sila. It is our job na tulungan po sila. Okay? From Larin again, magandang umaga po. Kapag po may COVID ang isa sa mga kasama po sa bahay, ang iba wala o hindi mahawa, pwede po. Yes, ma'am. This is actually a very interesting topic. Kasi po, on Thursday, we will have Dr. Tina, Doc Tina po. And she's a community pediatrician and a measles expert. At, I'm sorry, na ano lang ho. One of the things that Doc Tina is going to discuss po, and actually the subtopic po ng ating measles is, alam niyo ho ba na yung measles ay mas grabe pa pong nakakahawa sa COVID? And why do I say this? Okay? If there is a person or a kid with measles, usually kids po, no? And then they went to, say, an elementary school, a classroom po, no? And then none of the kids na bakunahan, 90% of the children in that classroom will develop measles. So, nakuha niyo po yon. That's how grabe po ang measles. Hindi po ganun ang COVID. In COVID, there have been many cases po na talagang kasama na ho nila sa bahay, that person did not get sick. So, what is the meaning of this? It means po, I do not know the exact term po, and let's ask Doc Tina, but yung infectivity po ng COVID is not 90% unlike that of measles. Very interesting. Ikaw, Reina, as a mom, what do you think of that information?
Ako talaga, Doktora, hindi lang po.
Hindi, no? Oh, I never knew that about measles.
Yes, hindi lang yun talaga ang wina-watch out ko. Magka-rashes lang mga babies ko. Talagang tumatawag ako sa PD agad. Kahit 11 p.m. And I'm very thankful sa PD ako. Very responsive, lalo na ngayong pandemic.
Talagang measles nakakahawa talaga, grabe.
Yes. Pinipicturean ko pa yan and then I'm sending it to my doctor via Viber. And then yun. Kasi mahirap. Even my doctor already, yung sa pedia po nila, already expressed to me na watch out for measles kasi kailangan talaga bakunahan sila para hindi magkaroon ng measles because it's deadly. Deadly talaga siya.
Deadly and it's highly contagious. Isa pang highly contagious na gusto. I will never forget this, ma'am, ha. Papunta po ako ng Amerika, nabakunahan po ako ng Hep B. And I was Hep B negative. But it is a requirement po sa US. And now, ngayon sa Pilipinas, ikaw, Reina, as a healthcare worker and as a nurse, you need to be vaccinated for Hep B. Alam mo yung sinabi nung nagbakuna sa akin, who was my professor po. Sabi niya, Ana, sobrang nakakahawa ang Hep B. Sabi niya, if we put a drop of FB in a pool, and then you jump in that pool, kahit napakalaki ng pool, magkakaroon daw ako ng Hep B. Ganun daw kagrabe ang Hep B. Okay?
That's true. Asymptomatic.
So if you guys, COVID is the worst disease in the world, marami pa po. Okay?
Doktor, ang Hep B is also asymptomatic at first. Onset nun, hindi mo alam talaga na meron ka. After ilang days mo pa malalaman kapag ka nagkaroon ka na ng paninilaw, ng yung masakit ang katawan, ilang araw yun, biruin mo, nagkainan na kayong magpapamilya, lahat na kayo may Hep B sa
very infectious po. Hep A, Hep B. Hep B pa daw mas grabe. Okay, so actually, one of my classmates is the Philippines expert on Hep B. So siguro let's invite Dr. Janus to join us.
Yes.
Talagang passionate din siya about Hep B, and he is the chairman po at the Medical City, also po at Philippine General Hospital, trained in the US. Okay? So let's move on. Ang daming tanong ni Larin, but I like them all. Bawal po ba ang pag-inom ng kape at gatas sa mga merong heartburn, acidic na tao? Ma'am, I would, ano man tanong mo? Gatas o kape? You can drink milk. There's nothing against drinking milk sa mga what we call po this is heartburn or um, talagang po yan, parang feeling mo talaga, it can resemble a heart attack. Opo. And I would, ipapagbawal ko po talaga, kung talagang grabe po, ipapagbawal ko po ang caffeine. I would. Or at least in the morning, not in the evening. Okay? It can cause. From Larin again, ang swab test po ba ay maaari pong magkamali? Yes, wala pong test na there is no test that's 100%. And the swab test po is highly dependent po on the day na gagawin po. As I've always said po, day 1 is exposure, day 3 po, that's the time that the swab test will become positive. So kung na-expose po kayo ng Monday, halimbawa po, yung co-worker nyo, nakasama nyo po on Monday morning, Monday afternoon, binalita sa inyo ni bossing na positive yung kasama mo that morning. Huwag kang susugod sa swabbing laboratory. Kasi po talagang negative ang makukuha mo. You have to, kasi parang pumasok lang ho sa katawan nyo on that day po yung COVID. So kailangan umusbong pa ho siya. And that will happen mga day 3 to day 9, day 10, day 9, ganon, day 8, day 9, ganon po. So, pwede pong, you can actually have COVID, but the swab test will not pick it up. Okay? So, yun po yun. From Jasmine, hi Doc, good morning. May schedule na bang topic for liver? Waiting po ako. Naku, kasasabi ko lang, Hep B, that's a liver disease. From Larin, ang tigdas po ay kadalasan sa bata lang po. No, actually. Adults can get measles. After surgery, what is the best vitamins to avoid pain? Wala pong vitamin from Vilma. There is no vitamin po to avoid pain. I'm sorry, Ma'am Vilma. Wala talaga. Wala pang ginawa ang Panginoon na vitamin to avoid pain. Hi, Doc. Good morning. Please discuss the latest update that the flu is deadlier than COVID. Sir, I'm sorry, but the death number po of COVID is higher than the flu. So mas marami po talagang namamatay po ng COVID. So there is, people used to say na, hindi, flu lang yan, ganon. No. The mortality number of COVID is falling, but the flu is still higher. So I cannot discuss that po. For the past, yung pinagay ko no Saturday, Reyna, are you guys ready to read that?
Yes, Doctora.
Sige. Ito, nahanap ko from Jason.
Okay.
You can flash anything. Doc, tanong ko lang po about the antibody test and the antigen swab test. If okay po bang gamitin yung antigen swab test, mas accurate pa po ba siya? Kasi ang dami pong hindi makaka-afford ng RT-PCR. Meron na pong, what is, haba nitong usapan ng magandang tanong na to. Jason, ito na lang. Kung masyado pong ma-expensive ang swabbing, magpa-quarantine ka na lang. Pareho na lang rin din yon. 14 days, you just be quarantined. For example, na expose po kayo to a person on Monday, you cannot afford a swab test. What should you do? You should quarantine yourself for 14 days. And after that, tapos na po yung problema. Whether or not you have symptoms, if you quarantine yourself for 14 days, you will be okay. So actually, it is very valid naman po na wag na pong magpa-swab. Lalo na po if you can't afford it or kung halimbawa po yung tatay niyo po nagkaroon ng COVID. Okay? 7 children and 3 lolos and lolas. So the swabbing is say 5,000. 5,000 times 7, that's 35,000 na po, no? Plus 3 lolos and lolas, that's 15,000. So that's 50,000 pesos. Mabigat po yun, okay? What should you do? What should you do? Okay? If you cannot afford to be swabbed, do not do the antibody test. Yung 7 na anak, si tatay, si nanay, and the 3 elderly should stay in the house at ikandado po yung bahay. Walang lalabas. Okay? Walang lalabas. Okay? That is effective enough. Pa-quarantine kayo doon. If anybody has symptoms or grumabe, then yun po yung ipaswab nyo if you want to. And then, or if somebody needs to be brought to the hospital, yun po yung iswab nyo. But the rest of the people in the house, if you quarantine yourselves there, talagang strict ha, and with the ano of the barangay, that's more than enough na po. And then after 14 days, pwede na po lumabas lahat ng tao, that's okay. Why would people swab themselves? Kasi po marami pong, sabi nga ng husband ko, the term is the agony of not knowing. Kaya lang, if your father became COVID positive and you are swab negative, kung ako yung barangay, i-quarantine pa rin kita kasi mahirap na yun, na-expose ka talaga eh. So it's very valid na magpa-quarantine na lang po. Okay? Magpa-quarantine na lang po. What is an antigen versus an antibody test? An antigen test po is a test for the proteins on the coat of the virus. So, pwede na po siyang gawin. It is an early test, so it can also tell you po if somebody is infectious or not. The Philippines is one of the first countries in the world doing the antigen testing. Right now po, wala pa po masyadong datos tungkol doon. The swab testing or the RT-PCR is a test of the RNA of the virus itself. So very accurate po 'yon. Kaya lang may pagkamahal. The antibody test naman po, that is a late test. Yun po yung test na nagte-test po kung yung katawan nyo after having COVID and nag-form po ng antibodies. Yung antibody test, as I've always said, will never tell us kung nakakahawa ka pa ngayon. In fact, the antibody test, kasi late na po siya, people form antibodies day 10, day 11, day 14. Eh kaya lang alam natin yung infection is day 3 until ano po around day 9 or day 10. So the antibody test po, it is a late test and people use it po to find out kung may antibody po sila para pa makapag-donate po sila ng plasma. Okay? So yun po yun.
Laura, let's flash some questions.
Sige, go. Andito lang ako. I'm just reading the comments kasi wala pa. Why don't you just read the comments for me? Kasi nahihirapan din ako eh. I cannot read it, it's too small. Basahin nyo na lang.
Okay, let me read it na lang po, Doktora. This is from Miss Bebe Ricasef. Dr. Ana, good morning po. Ask ko po sana yung son ko 7 years old. 1 month na siya inuubo pero wala po siyang lagnat. Malakas naman kumain at masigla. Nag-give na po ang doc sa kanya ng mucolytic and antihistamine for 2 weeks. Di pa din po nawawala and nag-antibiotic na po siya for 7 days. Ganun pa din po, inuubo po mas madalas sa gabi po, Makati daw po lalamunan niya. Ngayon po, antihistamine na lang po ang tinitake niya and ano po pwede kong gawin. Thank you po.
How old is this person?
7 years old daw po yung anak.
Eto lang I'm not a pediatrician and I do not want to pretend na alam ko yung mga nasa bata. Okay? Pero I'm a pulmonologist. Ang advice ko, investigate asthma. Pero my best advice po is OKOPD, Jose B. Lingad Memorial Medical Center, and see a pediatrician, ma'am. And you might mention that I said asthma. But again, I'm not a pediatrician and I don't want to pretend po. Masama yun. Okay. Next po. But thank you for asking. Ako, personally, I'd investigate asthma.
Next question, Doktora, is from...
So, wala kang sinabing binigyan po kayo ng... Eto lang that's why I cannot answer individual questions. Sagutin niyo po itong tanong niya ito. Okay, sagutin niyo. Is this the first time that this happened to your child? Number 2, okay, what is the history of this child? Known asthmatic po ba ito? Nangyari na po ba ito? Na-hospital na ba ito? Number 3 question, kayo po ba ay gumamit ng inhalers in the past? Number 4 question, kayo po, mommy, daddy, lolo, lola, mga kapatid, sino po ang may asthma sa pamilya nyo? 5th question, Where do you live? Do you live in a farm? Do you live in a condo? Do you live in a place po na like a factory na marami pong umiikot po na mga dusts? Okay? Number 4 question po. Ano po ang gamot? What specifically? You never mentioned inhalers. How about Ventolin? Number 5 question po. Meron ho ba kayong mga aso, dogs, cats, hamsters, birds in your house? Okay? Um, so, Miss Rains, do you understand why it's so difficult to answer the individual question po? Kasi po talagang yun, kailangang imbestigahin ko lahat yon before I can give you a proper answer. So, what I can give po are general answers po sa mga questions. If this is a in-depth, and I believe that every consult po should be in-depth talaga dahil karapatan niyo po yun bilang pasyente. Hindi ho lang ho kayo pwedeng daanan ng mga doktor to give like mga yung buga-bugang sagot. Hindi tama yun eh. You have to know the person, you have to know the patient, you have to know the background, you have to know the parents. Bago ho masagot lahat yon. Nakuha mo yung dami ng tanong ko, Reyna. Lahat yon valid po yun sa kaso ni Madam. Opo.
Kailangan talagang himayin. Himay-himayin.
Oo, talaga. Yes, so please guys, if I give you an opinion, it is my personal opinion. It is not for your case alone. But it is a general opinion po based on what you told me. Okay?
Agree.
So, ang advice ko po dun sa mommy po na 7-year-old, see a pediatrician. You may consider po asthma as one of the reasons po that you might want to see the pediatrician. But again, baka ho, iba ho yung hatol ng pediatrician kasi hindi ko naungkat lahat. Okay? So don't go to the pediatrician and say, sinabi po ni Dr. Ana, may asthma po yung anak ko, go. Hindi po gano'n. Okay? But thanks for asking. So yun lang po.
Next question is from Miss Maria Nanita Linghap. Doktora, ano po kaya itong matagal ko nang iniinda? Masakit po sa akong ko na kumikirot, pati po tuhod ko. Di ko po maibaluktot ang tuhod ko po. Nagpatingin po sa dugo. Di naman daw po mataas acid ko. Meron po siyang sinabing gamot. Dolonirobion po.
Dolonirobion.
Apo. Ang nireseta sa akin, kaso pabalik-balik lang din po ang nararamdaman po.
How old are you, ma'am?
Wala pong na mukhang
that's question number 1. Opo.
Yes.
It sounds like arthritis, but again, best advice, go to the doctor po and doloneurobion po, that's B1, B6, B12. Maganda po yan. Are you diabetic? That's another issue po. Okay?
Ako naman, Doc, based naman sa mga usual na nakikita ko, nagpunta sila sa doctor nila. However, yun nga, may mga tanong pa rin sila. Ako po, ang suggestion ko po sa inyo, ipunin nyo na po lahat ng tanong nyo para pag kaharap nyo po yung actual doctor nyo, maitanong nyo po lahat. Huwag po kayong mahiya.
Yeah, don't be mahiya. Pero Reyna eto lang some people do not give their cell phone to the patients. I always give my cell phone to patients. Kasi, eto lang tama yung sinabi mo ipunin nyo lahat ng tanong nyo. But sometimes, lalo na when you're there in the doctor's office, sometimes natataranta ka sa dami ng sinasabi. That the questions, I always tell people this don't hesitate to call me 2 days after. Lalo na kasi ay mag-cancer specialist So talagang pag narinig mo yung cancer, oh my God, babagsak ka muna. You cannot remember anything after that word, okay? Nangyari na talaga 100 times to people ito. Talagang, oh my God, talagang wala na, complete devastation. So, what I always tell people, I give them my cell phone, I tell them, you know what, the questions will come in 48 hours to 1 week after this. Plus, so many people are gonna tell you so many other things, okay? So sabi ko, huwag kayong makinig sa mga sasabihin ng lahat ng tao, including the internet, okay? Listen to your doctor. Because the internet did not take your history and PE. Yung doktor nyo yung nag-history and PE sa inyo. So wag ko kayong mahiya. You can either schedule a second appointment or if talagang nagpapanik na kayo, call me again in 48 hours. Kasi dun lang papasok talaga lahat ng tanong. Lalo na when someone tells you a bad news, Diyos ko day. The questions and the comments will come after 48 hours. So, yun lang. Pero tama ka, if it's a benign diagnosis naman, ipunin nyo na rin lahat ng tanong nyo para pag nandun kayo sa harap ni Doc, go.
Yes, ako I always tell pagka may mga consultations with doctors, I always tell them, Doc, please bear with me, ito lahat ng tanong ko. Lahat talaga.
Oh.
Kasi mahirap, doktora, na mangapa. Mahirap
Yes. And then later on, you're asking the internet, ano bang alam ng internet tungkol sa history and PE mo? Di ba? Yung doktor mo, that's really the best person for you to consult. Ngayon, if that person doesn't want to answer your questions, that person should not be your doctor. May karapatan po kayo.
Yes. Next question, doktora, from Capsilvina Lazara. Hello, doktora. Good morning. Ano po bang pwede gawin? Baka matulungan mo ako. Nagpa-inject po ako sa aking kamay. Ang tawag po is steroid. Nagpa-inject daw po siya ng steroid. Kaso po, ang daliri ko ay naglalak at hindi ko basta ma-close and open. Sa gitna po yan ng kanang kamay ko. Pagkatapos po ng injection, hindi ko na halos matiklop ang kamay ko. Ano po ba maganda kong gawin in second time? Wala pong binigay
na... Ano po yung diagnosis nyo?
Wala po siyang nabanggit, doktora.
How can I cannot answer that without is this, ang dami pong steroid injectables and ulnar nerve palsy, trigger finger, ang dami po ano po ang sinabi po nilang sakit nila?
Agree ako sa tanong mo.
I can't comment po. And then who injected po the steroids? Was it an orthopedic doctor or a rehab? Opo. And then again, I'm not an ortho, but I need to know the diagnosis, mami. Opo.
From Mr. Arnel Reyes, doktora, matagal na po.
Ma'am, you can put it down po sa baba para makapag-comment ako later. Balikan po natin yan. Okay.
Next question, doktora, from Mr. Arnel Reyes. Doktora, matagal na po akong diabetic, high blood at iba pa. May neuropathy pa na rin, pero problema ko itong rhinitis ko, pabalik-balik na sipon. Pagpunta ko sa doktor, antihistamine lang ang huli nila nga, Sinopen yata yung binigay. Sinopen daw po na gamot.
Okay. So you're having rhinitis. Okay.
Yes.
Sir, ang tanong ko sa iyo, what is your environment? Saan po kayo nakatira? Kasi po, kaya nga allergic rhinitis saan po, what are you being exposed to? Marami ho bang pollen doon? Pets? Dust? Palay na ginigiling? Okay? Kailangan po nating malaman yon, and you have to remove all of those po from your environment. If you have a dog, it should be a non-allergenic dog. So, matindi po talaga ang requirements. And then, you also have to keep your bed clean. Clean talaga yung environment niyo po talagang kailangan. Another thing, if you have tried na po na, how long were you given the antihistamines? Sometimes people need to take them for a month po. And then you might also try po steroids. You might try, not oral, yung inhaled po. Pag-usapan niyo po yun with your doctor. And it's really, really, rhinitis po, it's very difficult, it's very chronic. At ang nakakatakot po talaga ngayon is, ngayong panahon po ng COVID, anybody with sipon, like if you try to go to work po, if you have a job, and then, though I think, kayo po dapat work from home na ho sa dami ng sakit, But let's say you're a young person with a job, and then the question is, inuubo ba kayo and sinisipon? And you answer, yes, hello, COVID testing. So, yun po talaga yung difficulty ngayon ng mga chronic lung diseases or chronic allergenic diseases po. You might be mistaken for COVID. So, that's really not good. Opo. Yung mapagkamalan po kayo may COVID, though actually 3 months or 6 months or 1 year na po kayo na allergy. The best thing po for allergy is to remove po the allergic material.
Next question na tayo, doktora.
Thank you for asking that. It's a difficult time po for mga allergic rhinitis. Tumawag pa nga yung tita ko na nabigyan po siya ng yun po, inhalers, steroid, and antihistamine via pulmo, her long-term pulmo. Okay? Next.
Okay. Hi, Doktora. Puto lang po si Doktora. Let's wait.
I'm sorry. Opo. Naputol ba? Are we lost?
Hi, Doktora. You're back na po.
Hi, thank you.
Hi, Kat.
Opo.
Okay.
Okay na?
Okay po. From Sarah Simbulan Santos. Good afternoon po, Doktora. Nag-start pong sumakit ang talampakan ko sa baba ng pangalawang daliri ko. Naputol po ulit si Doktora. Let's wait for her po.
Opo. Sorry.
Sige po, Doktora, take your time. We will wait for you po.
Opo.
Hi, Doktora. You're back na po.
Thank you. I'm sorry. Opo. Please continue. I would just like to tell everyone na I'm sorry kung medyo putol-putol yung thoughts ko. Kasi po, I did not read the questions beforehand. Kasi di ba, when you go to the doctor, hindi naman ho alam ng doctor kung ano yung problema nyo eh. So,
Yes.
sometimes they really just have to tell you as it is. So, sige po, go.
From Miss Sarah Simbulan Santos. Good afternoon po, Doktora. Nag-start pong sumakit ang talampakan ko sa baba ng pangalawang daliri ko sa paa. Pag nadidiin, simulang mag-walking ako 2 weeks ago. Ngayon po, 2 days namang sumasakit ang binti ko sa kanan, simula sa may puwetan hanggang sa talampakan, pero from taas ng tuhod hanggang sa calf muscle na mamanhid siya. Hindi po ako makatulog sa gabi, nangangalay po lalo na pag nakahiga.
Ma'am, you just started walking. Baka naman nung nasobrahan kayo. Opo. Sometimes, and I would like to tell you this, ako rin, nasa edad na rin tayong lahat, pag nabibigla po tayo sa exercise, kuminsan talagang masakit. I would suggest that you start slow and then you build up po. Ngayon, kung talaga kung magpa-persist yan, well, then we need to work that up. You might try po warm compress ng konti. Hindi naman ho yung nakakasunog, but you might try warm compress. If it doesn't work out, then if it continues to be extremely painful, you might consider sciatica po and perhaps a checkup.
Next question from Mr. Ferdinand Jimenez. Darna, Doktora Ana. He called you Darna daw po.
Wow.
Good PM. Ano kayang posible ang nararamdaman ko? Napakabilis ko nang mapagod ngayon kasabay ng pananakit ng dibdib at minsan kabag. Naitakbo na ako ng ER nung March dahil sa sunod-sunod na pananakit ng dibdib. Hirap sa paghinga, negative naman po mga lab ko. ECG, X-ray, urine at hindi rin high blood. Thank you. Ang hirap ng case niya.
You? And what is your cholesterol? Are you diabetic? And then, eto lang po, if this sounds like angina or heart-related pain po, ang ECG, X-ray, will not tell us. You need a cardiac workup po. So, kung talaga pong the situation is getting worse, I would suggest po a cardiologist. Lalo na po if you're over the age of 50, you're diabetic, you're male, and you're a smoker. We need to look into the cardiac aspect. Ngayon po, pag na-rule out po si cardiac pain, then that's when we go into the non-cardiac pain. That includes po yung sinabi po nila na gastritis and esophagitis, yung parang may acido po. But again, rule out po muna si cardiac pain. Opo. Okay? So you need a further cardiac workup po, lalo na po if the situation is getting worse. Don't panic. Meron hong ano doon. I know people panic at two words. Number one, heart. Number two, cancer. O number three, stroke. Pero ngayon, number one, COVID. Okay, sorry.
Next question po from Miss Sel. Doc, concern ko po sana nagdadry at nagsusugat lower lip ng anak ko, 9 years old. Ano po kaya pwede igamot? Last year nagkaganyan din siya ni Reseta Roa Gel. Pero ngayon, di pa din po gumagaling. Salamat po.
Ma'am, talagang I'm not a pediatrician eh. I really am not a pediatrician. Mas yung tatay pa nga ho ng anak ko yung tumitingin sa anak ko kaysa sa akin kasi talagang hindi talaga ako pedia. Ma'am, you might try lip balm and then later on po maybe see a dermatologist. I'm not a pedia. Opo. Ito. On Thursday, there will be a pedia. So lahat po ng mga pedia questions, bumalik po kayo sa Thursday. Opo.
Yes, please.
That's the best thing that I can tell you. Thursday, there's a community pediatrician. Her name is Dr. Tina. She's really a nice lady, very smart. And she will discuss po with us measles and talaga pong measles is parang hindi natin na nabigyan ng ng importansya ang measles. But actually, it's also extremely deadly and very contagious. So on Thursday po, Dr. Tina. Opo.
Okay, next question po, Doktora, from Miss Glenda Franco. Hello po. Ano po ba dapat gawin sa mga nananakit na mga tuhod sa kapag nakaupo hirap pong tumayo? Seniority na po ako.
Aray ko. Hindi ka nag-iisa. That's what I can tell you. And it's happening to me, okay? Masakit yun, ma'am. Talaga arthritis, ma'am eh. And then, you need to take painkillers, heat. Some people try po apple cider vinegar. Ngayon ho, kung talagang grabe, well, then there's the knee replacement. So, yun po. Steroid injections and knee replacement. Ortho, I can refer you to an ortho. My classmates, magagaling. Opo. Sana wala pa tayo sa knee replacement.
Next question from Miss Ides Marquez.
Doktora, I'm sorry, Miss Rains. I'm actually very curious and I would like to guest an ortho. If any ortho is listening, you're welcome to PM me. Knee replacement, hip replacement. Ang laki na po ng yan. Ang dami na po ngayon. We need to know more about that.
Okay po. Let's move on to the next question.
Sige po. Thank you.
From Miss Ides Marquez. Doktora, sumasakit po ang upper part ng likod ko, bandang gitna. Hindi naman po ako inuubo or sinisipon. Nagpa-chest x-ray na rin po ako. Wala naman po nakita. Pakiramdam ko po parang ngalay. Ano po pwede kong inumin na gamot sa pain? Thanks po.
Back pain. How old are you, ma'am? And what kind of work do you do? Where do you sit? Sometimes po, people develop ngayon eh. Are you work from home? Ganun ba? Are you in the age na work from home? Madalas po ba kayo mag-tablet? Kasi po, ang dami pong masakit ang likod ngayon because they are using mga house chairs. And then, naka-work from home sila rin na 6 na 8 oras. And then, talagang yung posture po nila, back pain. Okay, neck pain and back pain. So, I don't know po kung ano po yung edad nila and where you are sitting. Okay? Another issue po, of course, I'm also worried about back pain kasi if you are she sounds like a lady, no? But if you are menopausal, diabetic, overweight, and a smoker, even if you're female, yung referred pain po ng chest can go to the back eh. So make sure po that your heart is also okay. So yun po. And if all of that is okay, baka naman ho arthritis lang talaga. Yun. Okay? So yun po.
Okay, Doktora, that's all the question that we gather from our FB page. We can move on to our live audience.
Questions.
Yes. Pagsabay na natin yung pagbati and mga questions.
Opo. From Talia, how are you? Wait lang po. Opo. Ayan. From Eden, good morning. Ma'am Reyna, you missed this question. Ako muna ha, sorry. From Limwil Sanchez Egcalinos. Good morning po, Doktora Ana. Pwede po ba kahit anong gatas inumin sa mataas ang uric acid? Hindi po nagko-contribute ang gatas sa pagtaas ng uric acid. Ma'am, how old are you? I think it's okay to drink milk. Wala naman pong ano. And the second question is, why do you need to drink milk? Are you, ano po, are you, sometimes po, elderly persons, we encourage them to drink milk. Opo. There's really no reason to drink milk personally if you're eating a good diet. I'm not a fond milk drinker, Reina. And majority of the Filipinos are actually lactose intolerant. But if you want to drink milk, wala naman pong masama. That's what I could say. Opo. From Arnel Mora Monterde. Ang ganda nito eh. Master Masino. Fight COVID po. Fight F. Fight A against C COVID. E epidemic. M makes A all S safe and K protected. So, yun po yung ano niya, face mask. Ano po? Ang ganda. Ito, from Miss Remedios Nogoy Jeronimo. Ano po kaya ang dahilan at sumasakit yung kabiyak ng likod ko malapit sa batok? Pag tumingala po ako, parang nangangawit at masakit. Ma'am, sa mga bata po, no? I don't know how old you are. Sa mga bata po and those who use tablets, it is positional po from nakaganon sa tablet. So, kung kayo po ay mahilig mag-tablet, bring it up to eye level. Opo. From BB. Ito, nabasa na po natin si BB. I think we covered all. How about yung mga present comments, Reins?
Doktora, pagsabayin na po natin ang
sige. Okay, go.
Ang greetings.
Yes, ikaw na magbasa.
From from Miss Eden Abinal Ignacio. Good morning daw po.
Hi Eden, kumusta ka? Thanks for joining us on a Monday. Opo.
From Miss Mildred Martinez Calderon. Pagkaubo po ba, Doktora, COVID agad yon? Tinatanong niya po kung umubo daw po ba? COVID daw po ba?
Depende kung sinong umubo. Kung may COVID yung umubo, nako, that's not good. Kung wala namang COVID, well then, baka nahawa ka lang sa colds niya.
From Miss Clara Santos. Good morning po.
Ay, Ma'am Clara. Is this Miss Clara Santos Ortega or iba pa?
Yes po. Clara Santos Ortega.
Hi, Ma'am. How are you? Good morning. Thanks. Friends ko yan.
From Mr. Ralph Achura. Good morning po.
Hi, Sir Ralph. How are you? Thank you for joining.
From Miss Gina Diwa Nuki. Watching from Makabebe. Good morning daw po.
Ma'am Gina, how are you and good morning po.
From Mr. Elvis Kiambao, good morning.
Sir Elvis, magandang umaga din po.
Mr. Ralph, I'm watching from Mandaluyong, Doktora.
Wow, tiga Mandaluyong din ako, Sir Ralph.
From Miss Talia Natalia, watching from Palawan.
Wow, ang layo nun, ma'am. How are you in Palawan and I hope that you are safe.
From Mr. Chad Casilian, good morning po.
Sir Chad, good morning din po.
From Miss Shirley Tulod, good morning po, watching po from Barangay San Gabriel.
Kapit-bahay ko yan. Hi, ma'am.
Mr. Albert Canlas Nukung, good morning po sa inyo, Doktora Ana, watching from Canada.
Wow, sir. Nasaan po kayo sa Canada? Parang I think, i-share niyo po sa amin where in Canada because I've been able to go to some parts of Canada but not all.
From Miss Marilyn De Jesus Cortez. Hi, ma'am. Doktora Ana, can animals like dog carry the virus that causes COVID on their skin or fur? Yun ang tanong ko.
Ganda talaga ng mga tanong ni ma'am. Ano, mapapaisip ka rin.
Yes.
Ma'am, ito po yung ano ko I did a video po on pets and COVID. Ito sabihin ko po there have been cases in Hong Kong po that there were dogs na naswab po with COVID. Pero what I know po naman is hindi naman po sila nakakahawa. So I don't think you should put face masks on dogs, but there have been few studies. There have been. Pero wala naman nabanggit to sa fur. Pero meron pong dog na nagka-COVID. Meron po, yon. Pero what I don't know, or what I know is hindi naman po nakakahawa si doggy. Si doggy po, nahawa kay owner. Yun po.
From
But
Mr.
thanks,
Gilbert.
napaisip ako dun sa tanong na yun. Ikaw, Reyna.
Ako din, Doktor. Actually, we have dogs in the house. And kahit yung mga dogs din, very careful din kami pag nilalabas. However, kasi din sila vector of din sila Pwede rin silang pagdapuan ng virus, ng germs, ng bacteria. So,
Ayan.
most likely,
just being, kami naman, we have 7 ascals. I think COVID is the least of our problems yung sa mga ascal na yan. Ikaw, Miss
yun
Kat,
din
do
naman.
you have any dogs or pets in your house? Andiyan ba si Miss Kat?
Na-busy po ata si Ma'am Kat.
Okay. Imbestigahin natin kung may pet si Kat next time.
Sige po.
Opo.
Let's move on to our greetings.
Okay, next po. Thank you for asking that question. Very interesting.
From
Marami
Mr.
pong pet
Gilbert.
lovers na nakikinig eh. Opo. Yes, next question po.
From Mr. Gilbert, hi daw po.
Ay, Mr. Gilbert, kumusta ka?
From Miss Isimay Leor. Ask ko po, Doc, bakit po lagi ako naiihi na wala naman lumalabas? Inaas niya po bakit daw po siya laging naiihi and then wala naman daw pong lumalabas.
Andito si Doc Dodge bukas. That's his question. Ang urologist, ma'am, answers questions based on the male genital tract and the male and female genitourinary tract. So, let's ask him. I don't know. Honestly, I don't know. Nung tinanong po yun kay Dr. Judge last Tuesday, incontinence, yung control po natin ng pag-iihi, that's a whole subject. Buong 2 oras yan ma'am. Honestly, I don't know. And if you would like to join us tomorrow, ilagay nyo lang po. The topic po tomorrow pala is kidney stones, bato sa bato. But Dr. Dodge po is an expert on the male genital tract and the male and female genitourinary tract. So yung bato po, hindi lang po sin sa lalaki. Sa lalaki po at sa babae. So from the kidney, from the ureter, going down to the bladder po, at lahat po ng problema ng pag-iihi, Dr. Dodge Limhoco, tomorrow po. I cannot pretend to be an expert po sa pag-iihi. Ngayon, yung urinalysis, alam ko yun, okay? Pero the mechanism po ng pag-ihi and the bladder, usually po, ang may alam niyan is, OB Uro. And there are, I think, only 2 in the Philippines. That includes Dr. Lisa Prodigalidad Habson. And the Euro na female, si Dr. Carmela Lapitan. But we can ask Dr. Dodge tomorrow. Pasyensya naman, may mililing natin expert on ihi. Urinalysis, yes. Okay?
From Miss Chiki. Hi, Ma'am Chiki, Bunya Sagkawili. Good morning, Doctor.
Chiki, kumusta ka? Oo, good morning.
From Mr. Ralph Achura, Doc, need pa ba magpaswab if a patient quarantine first week pa ng August?
Sir, ganito po yung bagong patakaran po ng DOH. The second swab is no longer necessary. For example po, first week of August, na-swab po yung pasyente nyo, no, and became positive. So ngayon po, nagpa-quarantine na po, no? And then 14 days na po. Sandali lang, first week of August, it's already September. It's already October. Hindi tapos na po yan, okay? So, okay, eto na lang. Let's go to the DOH guidelines. The DOH guidelines po is 14 days. Yun po yung tinatawag po natin symptom-based and time-based. So, tinatanggal na po yung second swab. So, what does this mean? Sabihin na po natin, on day 1, you were swabbed, okay? It became positive. So, that's your day 1. And then, kayo po ay na-quarantine po sa bahay nyo for 14 days. Let's say, mild, inubo, konting lagnat, but nalipasan nyo naman po. So, 14 days na po ang nakalipas, do you need a second swab? The answer po ngayon is no. So, 10 days after the start of the symptoms or 3 days after wala na po kayo totally na simptomas, wala nang lagnat for 3 days na hindi umiinom ng paracetamol, you can go back to work safely without needing a second swab. So bakit po nasa-swab yung mga tao na second time? Sometimes nire-require po ng kanilang trabaho. But the government of the Philippines and the DOH no longer requires that. So yun lang po. And is for this first week of August, tapos na po yan, Ralph. He can go back to work. Ay, sorry Ms. Rains, balikan lang po natin yung advice. That advice is for mild to moderate COVID. Ngayon po, assuming you have cancer, you have dialysis, you have grabbing diabetes, kayo po napakatanda na po, kayo po ay na-intubate at nalagay sa ICU, we cannot let you out lang po ng 14 days na yun na, sige, go. Kailangan po, I would suggest po that you be cleared by a doctor. Dahil meron, or you are pregnant, dahil meron po kayong mga tinatawag pong comorbidities po that could change the advice of the doctor depending po kung ano po yung kalagayan nyo on that day.
Okay, Doctora, next question po from Miss Marilyn De Jesus Cortez.
Oh no, ayan na naman si ma'am. Magagaling ang mga tanong niyan eh. Okay, go ma'am.
Doctora Ana, safe po ba mag-donate ng blood ngayong pandemic?
Ay ma'am, magandang tanong yan. Nagkaroon po ng bloodletting dito sa San Luis and people, were very kind to donate blood. Yes, it is safe to donate blood ngayong pandemic. Whether a COVID patient can donate blood, yan ang hindi ko pa... A COVID patient can donate plasma kasi may antibodies po yan for COVID. Mm-hmm. So I guess a COVID patient can donate blood. Ngayon po. But again, i-clear nyo lang ho muna sa Red Cross, ha? Opo.
Miss Presi Tarok Salunga, consult ko lang po yung palaging pananakit ng aking balakang.
Ma'am Presi, how old are you? Yun po. And then, ma'am, kung may edad na po kayo, a lot of the pananakit ng balakang is coming po from low back pain. A lot of our problems po from low back pain po are from bad posture. Ngayon ho, kung talaga kung grumagrabe na, as we get older po, there are, yung spongy layers between our spine is not so good. So, kung talaga pong nagkakaroon na po ng problema sa kanyang balakang, it's time for an orthopedic workup po ng inyong likod.
From Miss Tess Barrios Floresca, good day po, Doktora. Yung ankle ko po,
yes, opo.
Yung ankle ko po sumasakit, gumagapang yung pain paakyat sa right hip. Ano po kaya dahilan?
Ankle?
Yes, yung niya.
Ano yung bukong? Ano yan? Bukong ba yun?
Yes.
Ankle, A-N-K-L-E.
Yes po.
Ma'am, ang tanong ko sa'yo, were you an athlete? How old are you? Opo, were you an athlete? Kasi po, ito lang, I would like to let people know this. Yung mga previously injured joints, like for example, you were an athlete, you had a sprain, ganun po. Those are the joints po that are as you get older po, those are the joints that are going to be more prone po to arthritis. So I do not know po yung history ng inyong ankles. Like, were you a volleyball player? Did you twist your ankle at a certain point? Nabalian mo ba kayo doon? Kasi yun po yung magiging usually an injured joint is more prone po to arthritis than a normal joint. So I don't know what happened to your ankle. So it could be arthritis po. Obviously, kung mag-persist po, you need to have a workup. What's the workup? Start po with an ankle x-ray. Opo.
From Mr. Ralph Achura, next question tayo, Doktora.
Sige po, Sir Ralph.
Doktora, good morning. May connection po ba ang nephrotic syndrome sa autoimmune?
Yes, meron. Opo. Meron po. Meron. I'm not a kidney specialist, but I would say nephrotic syndrome po is when your kidney is putting out a lot of protein. So meron po. Yes, there are it's coming back to me. Okay. There are a lot of autoimmune diseases that present po as primary nephrotic syndrome. So there's primary nephrotic syndrome and there is nephrotic syndrome in a of autoimmune disease. So, if you have a rheumatologist po and nephrologist po ang dapat dyan. Meron din hong nephritis, iba pa rin ho yun. And there's a nephrotic syndrome in diabetics, so iba pa rin ho yun.
Okay, next question, Doktora, from Miss Arlene Nanasito. Morning, Doktora. Tanong ko lang po kasi yung nangalangala ko po, Dok, parang Makati na ewan, tapos lalamunan, parang may plema po. Thanks po, Doktora.
Ma'am, betadine gargle. And then kung if the situation gets worse, you need to have further checkups po. Kasi that could be a sign of, I don't like to say it, but ganito na lang, kung hindi po mawala at grumabe, kailangan ho ng checkups. Okay? Apo. Kasi alam mo, ito yung mahirap rin eh. I don't want to drop words na talagang papasok sa utak ng tao at hindi na mawawala dun eh. So, ito po, you can try the betadine gargle. Meron po rin mga oral gargles po that are pretty good. And if it goes away with that, okay. But if other things happen, then other checkups are needed. Wag na ho nating tanong kung ano yon until it happens.
Okay. So, next question tayo from Miss Minmin. So, laging masakit likod po, 39 years old, babae, parang muscle pain lagi.
Ma'am, as we get older talaga, our back is one of the most vulnerable points po in our body. My question to you is, what is your job? Okay? And I would like to bring this up, Reina, you are a nurse. Ang nurse po talaga, lalo na po ang clinical ICU OR nurse, yung likod po nila talagang... Kasi po, nursing is a profession wherein you really help people and you help them by touching them, moving them. You move from bed to chair, from chair to bed, from bed to OR. Are you a radiology nurse? From the stretcher to the CT scan table, yung likod po nila talagang gumu-goodbye. Opo. When I was much younger, I worked with a lot of nurses po. Talaga pong they teach you the techniques po to protect your back. Kasi po talaga, if you are a nurse, are you a rad tech? Moving people po talaga, grabe. You may not notice it when you're young. By the time you reach the age of 45 po, you ask mga nurses po, plus the hirap po ng standing on your feet, oh my God. If you are also an SM,
sales lady.
Ang SM employee, Diyos ko yung paan nyo po, tsaka yung likod nyo, goodbye.
That's true.
That's why, it is very important po talaga to find out the age, the experience, ano pong ginagawa nyo sa araw-araw, the job. Kasi po, ang dami po talagang job-related injuries ngayon po. Because we do that every day, including how you sit, where you sit. Meron pang parating kasi yung aircon pala nasa likod nila. So, ang dami talagang dapat ungkatin na talagang if your doctor doesn't ask you these questions, kulang po. Kulang. Because you cannot diagnose these things na, eto na yung ganon-ganon lang. Hindi. To be able to be a good doctor, you need to know your patient. And to be able to know your patient, you need to ask these questions. Eto naman mga pasyente, when your doctor asks them, wag po kayong maging, ang dami naman tinanong yan, ano ba? Yung pala, sakit lang sa likod. But that's part of it po. That is really part of it. Opo. That is really part of it. And be grateful po na talagang, yung complete po. A doctor who is rushing, that's never good. Kasi, you're gonna miss stuff. Yun po. You're gonna miss stuff.
So, let's move on to the next question, Doktora. Parang ang dami pong sumasakit ang likod.
Habang tumatanda tayo, Reina, the back, one of the most, talaga. Yes. One of the most vulnerable parts talaga ng katawan. Ikaw, you're a nurse. Didn't you have to move people twice your weight? Oh.
Yes, that's very true. And lagi kami nakatayo. At saka, another is, hindi lang sa mga nurses, baka naman din buntis ka. Kasi pagka buntis ka, sakit na mo. Na-epidural ka ba nung nanganak ka? Kasi one of the na din yun, na long time, lifetime na sakit or
Meron ganun.
symptoms. Oo, epidural. Doktora, ako, sumasakit lagi ang likod ko kasi wala na naturukan ka na ng something sa likod eh. So, yun, nagalaw na yung likod mo. So, wala tayong pwedeng pain management
Marami
dyan.
po talagang tao na yung kahinaan nila ay nasa likod. Marami po talaga.
Exactly. Pain management naman for sumasakit ang likod is hindi ka pwedeng forever uminom ng painkiller eh. Kasi magiging dependent ka doon. Tama po ba ako, doktora?
Hindi lang yun. Some of the more powerful painkillers can cause GI bleeds. There are exercises po para sa likod.
Yun, ang
And of
maganda.
course, you have to know how to lift properly.
Exercise
Ay,
talaga.
Rina, ito lang sabihin ko sa'yo Ito lang sabihin ko sa'yo. You might be blaming the epidural, but you have 2 children who are toddlers. Please make sure that you are carrying them properly.
Yes, don't worry, doktora. I taught them to how to walk and magpa-carry na magpa-carry.
Kasi maraming nanay na nagkakaroon. Kasi lalo na yung mga nanay of the overweight kids. Okay?
Ang hirap.
They're cute, but you don't know that they're straining your back.
But also, doktora, let's consider the height. The more shorter person you are or the taller you are, mas prone ka sa sasakitan likod. Tama ba ako? Shorter people and taller people, yung nasa extreme na yon, lagi yan ang magiging problema, sakit sa likod.
So ang tanong ko, when you carry something, eto lang Reyna, I'm asking you this, pag kinakarga mo yung mga anak mo, do you bend your knees or do you bend your back? You should bend your knees. Okay? You have to bend your knees.
You have
Some people kasi gumaganon eh. Hindi. Ibaba mo yung knees mo, kargahin mo yung bata. Yun.
Yes, kasi tutunog ang buto mo sa likod talaga. Pagka likod mo ang pinangbuhat mo. Tutunog talaga.
Okay, so guys, remember that.
Yes.
There's a proper way to live.
Sana madami kami.
Lahat ng mga tanong ko dyan, kayo yon na masakit ang likod. If you don't know the proper way to live.
Also, doktora, common din ang pagsakit ng likod sa mga diabetic person.
Pwede rin.
Yes, common sa kanila. We're not saying it's a symptom, pero it's common for them. Ayun, so let's move on to another topic from Mr. Vilma Taruk. Pwede ba ensure sa 49 years old galing sa pagkakatubo ng baga? Natubuhan daw po yung baga niya, intubation. So, pwede daw po ba yung ensure yung...
COVID ba to? What happened? I wanna know more about this kasi it's not, hindi siya simple, okay? Hindi siya simple. What happened? Is this a COVID patient? Ma'am, we still have a few minutes. I-share niyo po so that I could give you the better advice. Opo.
Yes.
Okay.
So,
kasi it depends. Reyna, kasi my answer to this will depend on what is the sakit of the person, okay? Sige, ma'am, i-share niyo po, okay? Opo.
Okay po. Next question. Inuulan tayo ng question. Pagka-ask Dr. Ana talaga.
That's why we held this because nalaman ko po na I was not able to answer all on Saturday. I felt so bad sa mga humabol. To be very honest, 30 minutes lang before, that's when I placed that there was gonna be a Q&A. So, sige, go.
Miss Vinia Alvarez, good morning po. Ako po ay 64 years old, diabetic pero controlled. Dati po ako ay may pabalik-balik na UTI. Last na gamot ko po ay levofloxacin pero nabalik pa din. Nag-try po ako ng garlic oil at hindi na po umulit. Pwede ko po ba ang prolonged use ng garlic oil?
Ma'am, Dr. Dodge, tomorrow. Tomorrow. I'm just gonna share with you what I know naman po about diabetics, okay? Yes, it is true that diabetics may be prone to repeated UTI. I also have Dr. Ivan Kudal on October 11. Dr. Ivan is one of the foremost diabetologists po sa Pilipinas. Kasi po, talaga pong prone po talaga sa UTI ang mga diabetics. Okay, we'll ask that to Dr. Ivan and Dr. Dodge later on. Sometimes po, sometimes the bacteria po in the UTI nagiging resistant na po to Cipro and Levo, fluoroquinolones. Napag-usapan na po ito ni Dr. Judge last Tuesday, no? So he was suggesting po a urine culture. And then, kung pabalik-balik din po yung UTI nyo, you also have to look for the presence of a stone. Okay? Or some obstruction po. Or maybe it's just due to diabetes. With regards po to the garlic oil, I am not familiar. Mas alam ko po yung cranberry juice. Ginagamit po yun sa Amerika. Cranberry juice po for UTI. But again, let's ask Dr. Dodge tomorrow, ma'am. Expert sa UTI at saka po sa mga kidney and obstructive problems that may cause repeated UTI.
Yes. Okay. Next question na tayo, Doktora.
Sige po, sige po.
Okay. From Miss Esquierdo Sheila Marie. Doc Ana, good morning. Ask ko regarding vaccine of flu and pneumo. Ano po ang uunahin ko? Thank you.
Mom, you can take both together. Though I try to take, and how old are you, mom? I would suggest you start with the flu. And then once, if you are senior na and older, you can give the pneumonia vaccine afterwards. Ayoko pong pagsabayin kasi po baka I just don't like to. Though actually you can pero ako po it's just I don't like to. So yun lang po. But I would suggest that lalo na po if you're more elderly. Opo.
Next question from Mr. Ralph Achura. Ang daming question ni Sir Ralph.
Oh, sige, go na, Sir Ralph. Kapitbahay ko naman yan from Mandaluyong.
Ang mga dogs po, meron silang coronavirus injection kapag puppies pa sila. Talaga? Meron ng coronavirus injection?
Parang sir, sige, keep on going.
Kasi nabasa ko dun sa vaccine record, may puppy ko before, may coronavirus vaccine. Hindi ko po sure kung somehow related sa virus natin at this time. I didn't know that.
Ako rin, Miss Reina, I am not a vet. If there is any vet listening, can you please share po? I don't know. Honestly, I don't know. What I know is parvovirus because si Oliver got a parvovirus shot. So Ralph, I don't know. Honestly, I don't know. Opo. Honestly, I don't know. Hindi ko po alam.
From Miss Arlene Anacito. Doktora, tanong ko lang po. Kasi kaibigan ko until now naka-quarantine po siya kasi 3 swab test niya puro positive pero wala naman po siya symptoms. Malakas po siya, Doktora.
Saan po siya naka-quarantine, ma'am? Where po siya, ma'am? Where in the Philippines? Kasi po, ito po yung and I would like to explain why the swab test can become positive a long time after. Kasi po, when you get COVID po, your body will attack the COVID-19 virus. So parang magkakaroon po, there will be like a battle inside your body. And then, papatayin po ng mga antibodies ng katawan nyo, the B cells, the T cells, the interleukins, the macrophages. Yung iba kakainin, like they will eat it literally. Yung iba naman po, papatayin. So there will be like pieces of dead COVID floating in your blood. Ngayon po, napaka-sensitive po ng ating swab test. They can pick up the dead COVID po, the remnants. Ang mahilig po natin sabihin sa medicine, remnants. You will hear that term, those are remnants. So those are remnants po na na-pick up na lang po. And I would like to reassure you kasi that's related to the question na may COVID pa ba yung pasyente? Or like how come somebody got COVID now and then months after na COVID test again? This is the Migs Zubiri story. No, Senator Migs did not get COVID twice. What happened was na pick up yung mga remnants ng previous COVID. And I also interviewed po the microbiologist and si MBB Joshua. Ang sinabi po ni MB Joshua, microbiologist Joshua. Summa cum laude po yan inaanak po. Sabi niya, kasi I asked him, how do you know it's not alive? Sabi niya, doktora, the lab will use amplification techniques. Tapos, titingnan nila, mag-grow ba siya sa lab? Yes, na-pick up siya ng test. Pero hindi po siya mag-grow sa lab. Okay, so basically, it's a dead part of COVID na nakukuha from that swab. So that person should no longer be swabbed. That person should be let out of the quarantine na po. Okay?
Okay, so next question from
Wala bang
Miss.
nagka-clarify dun sa kanina, yung mga tinatanong natin mga details?
Meron pong isa, pero
Sige,
follow-up lang
opo.
niya si
Okay, sige, later po.
Miss,
Okay,
or, hanapin ko
sige,
later,
go.
Doktora.
Oo.
From Mr. Vin Ocampo.
Okay.
Ma'am, ask ko lang
Ay,
po,
sigurado ko yan. Oo. Sige.
saan po usually nanggagaling ang bacteria na nagiging dahilan ng TB sa bone? Ay, ang ganda ng question niya. Gusto ko yung question niya.
Alam mo, TB is one of, somebody, na-mention din ito sa mga questions, tuberculosis. Sabi, Doktora, you're so focused on COVID. What about TB? And truly, when I trained sa US po, I trained sa US eh. TB was more seen in the context of other diseases like diabetes, ganoon. Nung panahon na yon, there was HIV, ganoon. So, TB was seen more in the context of other diseases. Pero in the Philippines, because laganap po talaga ang TB dito, TB can just be TB alone. And having worked in PGH, I have seen TB meningitis, TB, yes, TB of the bone, TB myelitis actually, ganon. I've seen TB sa lungs, TB sa everywhere, okay? TB sa lahat, okay? And in the Philippines, there are even, I've seen TB sa brain, I've seen TB sa CSF, o that's cerebrospinal fluid. I've seen TB in every single possible, having come from and trained sa PGH, okay? So, how does this happen? No? Um, TB is inhaled. Okay, so we get TB, and TB can go to any part of the body of a person. In fact, sometimes, eto sabihin ko sa'yo, my own mom had, pina-opera ko yung nanay ko for what I was sure was uh, lung lesion. Sabi ko, may she had a lesion in her lung. It was really round, ah. Pina-opera ko to sa Sloan Kettering. My own mother had a mass in her lung. I said, sinabi ng boss ko, Ana, this is either lung or breast. Yun lang. Dalawa lang yon, lung or breast. So mag-ready ka na. May cancer ang nanay mo, either lung or breast. So sabi niya, patanggal na natin yan para malalaman na natin what. Okay, so ready na kami ni Kong Rimpi for anything. You know what happened? Sa Amerika pa to ha. Kasi I was working there at that time. Not naman because I wanted my mom to be operated there, but because I was there. So, ang nangyari po is atypical mycobacterium. It was so rare. My mom became a journal article. So, ang ano nito is atypical TB actually. So, biro mo sarili ko nanay. So, what I'm trying to tell you is, Reyna, laganap ang TB sa Pilipinas. Laganap. Okay? Laganap. Laganap. And there's an entity called multiply drug resistant TB na talagang resistant na siya to the most common drugs, and this is very scary. So people can get TB in the Philippines. Most of them are diabetics. Kasi when you, the simple answer is TB loves sugar. Yun lang. That's a simple answer. TB loves sugar. So if somebody, ang dami ko nang nakita, my own employees, okay, um, tad-tad ang kanilang baga. Sabi ko, oh my God, lung cancer. Smoker pa ha. Then later on, TB. So, people can inhale TB in the Philippines. It is all over. Just ride the MRT. It's even more common than COVID, okay? You ride the MRT, you will get TB, okay? And now, it depends on the immunity na lang of your body. There are some people po talaga nakakalat si TB sa meninges, that's TB meningitis, sa baga, sa bones. So yon, it can happen. There's even TB salpingitis. Did you know that, Reina? TB of the fallopian tubes. Some people become infertile. Then, ni-imbestiga, bakit nagdikit-dikit yung kanilang fallopian tubes? Oh my God, TB. So, yon. There's TB everywhere. Pilipinas po talaga to. Sometimes we really just have lesser immunity po talaga. saan nanggagaling? You inhaled it and then it spread throughout your body. Why it went to the bones, why it went to the brain, why it went to, I've even seen TB sa eyeballs and stuff like that, okay? We don't know. Immunity na lang talaga ng tao yon. And TB is really a notorious disease. Um, did you know, Reina, that two of my lolo's sister died of TB. My lolo's brother died of TB, and President Quezon died of TB.
Ganun katindi. Diba?
Ay, ganun ko. President Quezon, ha? President Quezon. Until streptomycin was discovered after World War II. Streptomycin, the first TB drug, was discovered after World War II. But it was discovered too late to save President Quezon. So TB talaga, TB is everywhere. If you think COVID is everywhere, you haven't even seen TB. And ito lang, it's very interesting. The treatment for TB, Reina, is very, very similar to the treatment of COVID because it is a respiratory, inhaled droplet and aerosol infection. Have you ever been to Quezon Institute? You are so young. QI. I once went there when the PCSO was in QI. Noong unang panahon talaga, they will isolate the TB patients. And then the TB patients, they have to be in a place na talagang maganda yung hangin. That is QI. If you've ever been to QI, ang lalaki na mga kwarto, ang lalaki ng mga corridors, it's similar to PGH. Ganon. Because nung unang panahon, the treatment for the treatment for TB was really quarantining that person and putting the person in lots of fresh air so that their body could fight the TB infection. So yes, Sir Vin, na-inhale po ng mga tao yung TB and then it went to their bones. Ganun lang po. And why it happened, we don't know. Sometimes it happens to malnourished people. Sometimes it happens to cancer patients. When you have chemotherapy, umuusbong yung TB mo because it's immunity that keeps TB down. If you have high sugar, uusbong ang TB mo. But it can happen to normal persons. It happened to my mom. Okay?
Okay, next
Mahirap lang talagang intindihin at tanggapin. Yeah.
Yes. Next question.
It happened to my mother, Reina.
Oh, yeah. Nakakasad.
In the US, ha? In the US.
Nakakasad kasi naka-focus tayo sa COVID ngayon.
Pero maraming sakit, my God, marami. Measles na lang on Thursday. TB is another, alam mo, ayaw na lang natin pag-usapan ng TB because, you know, sometimes parang gas-gas na yan, whatever, but it remains to be a big problem sa Pilipinas. Especially among children.
Okay.
Ay, ito pa, sorry. People, one of the questions that people asked me during the pre-employment, diba there was a time that everybody was going back to work?
Yes po.
So one of the things really that I wanted, that I suggested, was a chest x-ray yung mga tao. In fact, a lot of companies require annual chest x-ray. It's not for COVID, it's for TB. Ganun siya kagrabe. Ikaw as a nurse, every year ina-x-ray ang mga nurses. Teachers also, every year ina-x-ray ang mga teachers. Factory workers, a lot of them. Kasi we live in close, TB, droplet, aerosol din yan.
Okay po.
Okay.
Yes, next question tayo, Doktora. This is from Miss Vilma Taruk, yung kanina po
Ay,
na...
ma'am, bumalik na si ma'am with the answer.
Yeah, follow-up inborn daw po na may bubbles baga. Inborn daw po na may bubbles ang baga. Habang tumatanda, nagiging weak ito, kaya pumutok po yun, kaya nag-collapse baga. Natubuhan po ako before mag-COVID, Dan po thorax. Po ba tawag doon?
That's actually called a pneumothorax. Repeatin nyo, ito lang ang pneumothorax po. There are sometimes, yes, it is true. It usually happens in guys, in males. Young, thin males between the age of 15 to 30. Okay? A lot of them develop apical pneumothoraces. What is an apical pneumothorax? Those are bubbles po talaga that will burst and then may biglang hihina po yung sometimes they are stapled, okay? They are stapled by using VATS, which is video assisted thoracoscopic surgery. Vinavats po yun, tubo po yun with a camera, and then they put instrumentation in and then they stapler it so that the pneumothorax will not recur. Okay? Um, what was her question? If you can drink Ensure? Yes, you can. You can. Mahirap na sakit po yan. Sometimes we use that sa mga case presentation. Usually, 25-year-old, tall, thin, lanky males. Biglang nahirapan pong puminga, then the answer po is pneumothorax. Okay? May pumutok po na bleb. The term is bleb. It's coming. The term is bleb. Bleb. B-L-E-B. Bleb. Opo.
Doktora, next po tayo. Ito po yung
Range
kanina.
contaminant, 1 hour and 25 minutes, guys. Okay. Okay.
Last two questions
Masyado ba
tayo.
ako mamadaldal? I'll try to keep the answer short. Sige.
Ay, no, Doktora. Very informative. Just please continue to explain. Kasi pag minadali natin, usually bumabalik sila kasi hindi nila naintindihan yung explanation.
Okay.
So, better to. Kasi nakita ko wala naman masyadong bumalik, wala naman masyadong nag-clarify nung statement mo. So, very, very informative. From Miss Sara Simbulan Santos, good afternoon po, Doktora. Namamanhid at nangangalay po ang right leg ko. Ayan na naman ang mga sakit. Masakit po siya lalo sa gabi pag nakahiga. Nag-walking at bike po ako, 48 years old. Salamat po.
48. Kailan po nag-start? And these usually nangangalay ng mga legs, they usually come po from the back. Again, our back po talaga, ma'am, it's a big, it's a big, as we get older, siguro nga we should have asa naman kaklase kong ortho, okay? Pumunta kayo rito, magpa-interview kayo, okay? JP Leung, Nick Nicomedes, I have Eman de la Paz. I know some of the best orthos in the Philippines, okay? The spongy po ng back natin, nagko-collapse yan as we get older. They have like mga spondylolisthesis and all these things. Basically, as the age po, yung spongy layer between our vertebrae becomes thinner, ganun po, as we age. And then, bumababa po yung vertebrae towards each other. Okay? And they kind of rub against each other. Yun yung masakit yun. Kasi parang yung cushion nila. Ngayon, dun sa sides po na yon, dun po lumalabas yung mga ugat. So, naiipit po yun. Okay? And let's get an ortho here to give us a better, Pero, as an internist po and a primary care physician, yun po yung sinasabi ko talaga. So, as we get older talaga, marami po sa atin magkakaroon po talaga ng sakit sa likod. Yung biyanan ko po na opera sa likod.
She answered, Doktora, from Miss Sara, 4 days daw po, nag-start daw po sa talampakan. Di ba nag-walking po siya and nag-walking?
Baka naman bigla nyo, ma'am. Opo. Again, if it persists, you need a checkup. If it persists, you need a checkup.
Yes. Okay, from last question from Miss Laliam Let. Doktora, kailan po kaya magkakaroon ng topic about sa mga lump and thyroid? Salamat po.
Lung and thyroid. Ma'am, ako po, I can do anytime lung. Just ask me anything about lung. Kayang-kaya ko po yun. Thyroid, let's look for an endocrinologist po. We've already guested si Doktora Mitos Kating Cabral and yung kanya po was osteoporosis. At that's another issue pa sa mga tao, yung humihina ang buto. So osteoporosis, problema rin yan, Rina. And then we also asked another endocrinologist, si Dr. George Tan, pero yung naging usapan po namin was diabetes. There's another endocrinologist po coming, Dr. Ivan Kudal. Number 1 daw ng UST sister and really a standout sa Makati Med. Dr. Ivan Kudal on October 11. Pre-diabetes naman yung kanya. Wala pa po tayong nagigest na thyroid. So if you are a young endocrinologist who'd like to share your knowledge about thyroid, please come. Kasi I'm not really quite an expert also on thyroid. I'm not really an expert, though I do know, kasi primary care, I do know about hypothyroid, the basics of hyperthyroid, and ano po what I can tell about thyroid, meron pong hypothyroid, mababa thyroid hormone, they have to replace. Meron pong hyperthyroid, too much thyroid hormone naman po, leading to thyroid storm. So, kailangan po beta blockers po yung gamot doon. And then, that's usually autoimmune. And then, number 3 po, the thyroid cancers, there's papillary, follicular, at saka po yung grabe. Marami din, and that can happen in young persons. Highly curable po si papillary. And then, number 4 po, sa mga thyroid po, there are mga thyroid masses and things like that. So, yun po. But again, let me interview or let me look po for a thyroid specialist. Maganda yan. Maganda yan.
Okay, so Doktora, yun lamang po ang ating...
Dami, my gosh, inulan tayo.
Yes.
Para ako nag-clinic, hindi man ako nakapag-charge.
Opo, pero ang dami mong
ang dami na clear. I try not to read the questions beforehand. Kasi when you enter a clinic, you don't know naman what the patient will tell you, di ba? So, I try to analyze the question. Kasi, parang hindi, di ba, pag doktor ka, di mo alam kung anong darating eh. So, you have to be ready, lalo na internal med. So, I hope that I was able to answer some of your questions. It is by no means comprehensive kasi po talagang biglaan lang po talaga yung question. But I hope I was able to point you in some direction that you can go to your doctor po and maybe know more about it. So sa inyo po, I'm inviting you to the Young Doctors Career and Job Expo. That's the only career expo po sa Pilipinas. That's on October 15 to 17. If you'd like to sponsor, we have almost 1,200 in our closed FB group and over 450 na po signed up. So sa inyo po lahat, thanks for joining us. Tomorrow, I'm really relying on Dr. Dodge. Ang daming tanong sa ihe, my gosh. Rina, ikaw, hindi ka ba naulan ng mga tanong sa ihe?
Naku, Doktora, malalaman natin yan tomorrow. Kasi madaming factors din eh. Bakit laging
marami. At saka po, ito lang about kidney and bato, which I always like to tell people, which also stayed with me throughout my many years of practice. Kung gusto mong ma-experience ng isang lalaki ang pain ng panganganak, and let's talk to Dr. Dodge about this later, tomorrow, yan ang kidney stone, Reyna, grabe.
Doktora, yes. May tito.
Parang nanganak ang lalaki. Ganun kasakit. And, I have seen people receive Demerol. Okay? Demerol talaga. Sa ER. Ganun katindi. Yun.
Naku, Doktora, gusto ko rin itanong tomorrow kay Dr. Dodge kung, kasi I have a colleague before na nagkaroon siya ng kidney stones because of intermittent fasting. Ayan, yung mga nag-intermittent
fasting. Yan, magandang tanong. Hindi ka iinom. Kidney stone na labas mo.
Yes, she posted it. Ang dami, 16 yata yung kidney stones. And she just got it from intermittent fasting.
Naku, ilagay mo na yung question na yan dyan kay under the Dr. Dodge picture.
Yes. Actually, I will, talagang nag-post siya ng picture with what happened and in-state niya, this is because of my intermittent fasting. Gusto kong malaman yan kasi ang daming nag-intermittent fasting ngayon. I myself was supposed to be doing intermittent fasting. Hindi ko lang natuloy because I'm breastfeeding, obviously. Pero I wanna hear about that. Hindi ko rin yun alam until I read that case and she documented it, lahat, pati yung day 1 ng intermittent fasting niya, pati yung pagsakit.
Until the day na she had many stones. Oh my gosh.
In 6 months time, Doktora, nagkaroon siya ng stones. And she didn't even eat a lot of chichirya or whatever. Sabi niya, sana pala kumain.
One of the things that I wanted to ask Dr. Dodge, is there an anti-stone diet and what would that be? Ayan.
Ay, gusto ko rin malaman yan. At hindi, for sure, hindi to intermittent fasting diet. For sure.
Yes, kasi I'm also concerned about the paleo diet. Pure protein naman yon. And what are the harm to your kidneys, ureter, and bladder?
Yes. And then the keto diet also. I've heard a lot
Oh,
of
yeah.
people na nagkakaroon din ng gallstone because of the keto diet. And yun nga, I was so shocked kasi I didn't know that intermittent fasting can cause that. I really don't know. Feeling ko nga, ano to? This is the first time I saw it. But then, she documented everything. That's
Ay,
why
talagang may litrato ng mga stone.
yes, I'm convinced. Ang lalaki ng stone, doktora. Ang lalaki. So, wala naman daw siyang history of gallstone before. Wala din siyang
Ngayon
history.
lang.
Ngayon lang nung nag-intermittent fasting siya.
Ano siya?
Again,
Kidney stone o gallstone?
both, doktora. That's why.
Both. Oh my gosh.
Yes.
Alam mo, ang nangyari dyan sa kidney stone na yan, hindi uminom.
Feeling ko,
I
doktora.
would like also to ask Dr. Dodge, ano ang dapat inumin? Kasi some people keep drinking like soft drinks and juices. Akala nila pwede na yon. So I wanted to clarify that issue.
So, meron daw 7 sa gallstone and then the rest was got from the kidney. So, gusto ko malaman, bakit anong nangyari? I am not yet quoting the intermittent fasting people na nagda-diet.
Mhm.
Again, we will clarify this tomorrow. Hindi ko
Ay,
kayo
oo, bukas. Maganda. This is
Gusto ko
going to close
malaman.
our Men's Health Month. I would like to thank Dr. Joben Abraham, Dr. Ryan Cablitas, Dr. Dodge Limhoco, my classmate Dr. JB Prodigalidad who helped me prepare po for these questions and sessions. So maganda po talaga. Okay, so tomorrow let's see Dr. Dodge. Okay guys, salamat po.